Did you ever wonder how adjusting the upper neck and adjusting the neck in general can affect your low back pain all the way down here? If this is a question that you've asked about chiropractic care, then you're in the right place for today's video. I'm Dr. Michael Hanselman. I'm one of the chiropractors here at Precise Chiropractic in Troy, Michigan. And today I'm going to explain how adjusting our upper neck can affect our low backs and low back pain, and also how anterior head carriage affects our low back as well. So first we're going to go by explaining this chart right here. This is called our Here's What Happens chart. And so this is going to explain how adjusting the upper neck can affect low back pain. So first off, the goal for anybody who comes into our office here would be this body balance, where we want the head and neck in a nice straight line with the atlas, which is this free-floating bone right here, this yellow bone. We want this to be nice and straight. So that's the goal for everybody who comes to the office. Now, when we have accidents, injuries, or traumas throughout the course of our lifetime, and sometimes it can be something as much as birth trauma. So 8 out of 10 infants delivered in a normal birth process can have enough stress put on their spine to cause that first misalignment. So what happens is, when the atlas misaligns from different accidents, injuries, or traumas, birth traumas, car accidents, falls, sports injuries when you're in high school, things like that, it can cause that atlas to misalign. And what happens when the atlas misaligns, it'll start compressing on the brainstem. And your brainstem is where all your muscle control centers for your whole body are. It's like a relay center or a fuse box where our muscles are working. So when that happens, then our muscles are going to tend to get tight and weak throughout our body that's trying to compensate for all that, and we get this postural distortion. Head comes off balance, shoulders come off balance, and hips come off balance too, as a compensation for what's happening way up here in the upper neck. So this is how we can affect the low back from adjusting way up here in the upper neck because of how we affect the brainstem with our atlas misalignment. Now the other thing that we have that's a common problem in today's society is anterior head carriage. And we do this from our forward posture, computers, watching television, watching tablets, phones, things like that. And so we tend to have this epidemic going on in our country right now of our heads going like this. Now when our heads come forward, every inch forward that you have anterior head carriage puts another 10 pounds of stress on your spine. So our head weighs about 10 to 16 pounds in that range. And so imagine, let's say it's a 15-pound bowling ball sitting on top of our head, and all of a sudden you have 1 inch of forward head carry. Well, now it's 25 pounds. 2 inches, 35 pounds. 3 inches, 45 pounds of extra weight from your head that not just affects just your neck and shoulders, but when you pull forward like this, it affects our center of gravity and can pull in our low backs too, as our body's trying to pull ourselves back upright. So these are a couple ways that adjusting the neck can have a key effect on helping our low back. So if you find this is you, where you're finding that your head is tilted, shoulders are high, we have these postural distortions, or you're finding yourself that your head arrives 3 seconds before the rest of your body does, you can give our office a call. Our number here is 248-680-7200, or you can visit our website at www.nuccainfo.com. That's NUCCAINFO.com. And hope this video was helpful for you guys, and I'm Dr. Hanselman at Precise Chiropractic in Troy.